So, hi guys, how are you? So we are starting at 7:30 today. For some strange reason, I can't find my glasses, but I can still use these. No, they're not as good as the other ones. These have that bifocal in them, and I can minimally see. But I did do a video earlier. I didn't post it because I saw all kind of stuff all over my mouth. So think about it. Okay, so this is the schedule. This is the schedule for this week. Okay, this week is chapter 5 and chapter 6. Today is Monday. So remember we had that extra chat for Tuesday, so that's why I added that in there. So just be kind of precarious of that. So today is revenue cycle management and hospital billing. Okay, revenue cycle management and hospital billing. Okay, we're going to now, I'm going to share my screen so I can show you guys what we are referring to. And I didn't see any stoppage from YouTube. So I think that we're doing it okay in regards to, where's it at? I think we're doing it okay in regards to the chats. Okay. So I'm just going to take this down so we can look at the other one. I'm not exiting. I'm sharing ad stage. Okay. So this is revenue cycle management. Okay. This is chapter 5. And we are receiving payments and insurance problem solving and collection strategies. Okay. So earlier, I was just kind of asking if you guys wanted to do 7. 9 o'clock was an awesome time on Saturday. I mean, you guys were really in here. Again, it's awesome for you guys. So let me know if you guys want to do 7 or 7:30. So I kind of started a little late today to see if that kind of works better. Maybe you guys were already settled. The other thing that I wanted to show you is really the Kindle. Um, I wanted to put it up here, but I was having a problem with my login in here, which is actually in there, but for some reason it's not giving me the books that I want. But let me take this down. You can't hardly see it, but this is my Kindle. Okay, is it upside down? I don't know. I hope it's not upside down. I know it's probably not mirrored, but if you go on Kindle, okay. Now I did give you. I know that's why I deleted the other video. I gave you a link that I did when I did a chat for my class for this. These are books. You see these books: CPT, ICD-10, HCPCS. They're all on Kindle, and Kindle they give you. You can look at a few pages for free. So this book, medical insurance billing, is also on the Kindle. Okay, so I would still do the Kindle because you can get those books. You can get those books free. Okay, I'm just going to drop the schedule up again real quick. So today is 5 and 6, and tomorrow will be 5 and 6. And this is what's in chapter 5. Okay, this is what we're going to go over today. Okay, that's what we're going over today. Let me get to the book. 6, healthcare facility billing, introduction to healthcare facilities and ambulatory surgery centers, billing for healthcare facilities. Okay, so this is what we will be going over today. Some of you, if you don't have your book, I would definitely try the Kindle to do some of it. And again, you can always go to sapphirecoding.com and check out the bookstore. Okay, guys, check out that bookstore, and you do get a free medical terminology book in there. Okay, so let's kind of get started. We're going to go ahead and open up. I just want to kind of backtrack a little bit on what we did in our last chat session. Okay, so we did documentation and coding for professional services. We did medical documentation and electronic health record. Uh, Session 12, ICD-10 CM. 13 was CPT coding and HCPCS level 2 coding. Okay. We also did the chapter 4, claim submission in the medical office, session 15, the paper claims, and session 16, electronic claims. Now, we did this on the last chat, and you guys know every time I come on, I kind of go over the last chat and what we did before we kind of move on, and that's because I want to keep you abreast. But I still want to reiterate: if you don't have your books, this is my Kindle. Well, it's my Apple, but this is my Kindle. These books, every single one of them are in Kindle, and you probably get like the first 100 pages free. um, I did this in my class and I did put a Zoom in there, but I really wanted to physically show you how those books actually come up in there. And you can use those books, okay? And that's free. It can give you like a head start on doing your work, okay? So we already went over what we are going to do in the classroom. So if you guys want to know that what the syllabus looks like, go to the front and you can see the syllabus. The syllabus is pretty much what's in there. Okay. I will give you a screenshot of an actual syllabus that you probably can go by. Let me see. We'll do that on the next session. We will do that, but it's the same stuff that's in your let me see, in your subjects. How do you do this thing? Okay, so I just stopped to share because I wanted to see where those things are. Oh, okay. So this is the student schedule. So this was it, and I just wanted to kind of put it back up here so you guys can see it. So we do have a syllabus. If you look at one of those chats that I have, the syllabus is actually in there, but I can actually put that syllabus up for you. I'm looking to see if the master is over here. I don't have the master over here, but I do have the registration over here. Um, it might let me do registration, but I don't want to be doing too much flip flop with you guys in here. We have to start the session because we only have an hour. But again, this is your schedule, and you guys know I show this mostly when we're in here. Okay, and this is your YouTube schedule. Okay, that's your YouTube schedule for this week. So let's go back to. We're going to go back to sharing. And then we'll go back to the book, the medical billing book, because we're now in revenue cycle. So now we can go back to revenue cycle management, which is what we'll be going over. And I'm just going to open this book. And we're going to talk about receiving payments, insurance problem solving. So you guys remember when I said, those are the objectives. So I'm going to go in and kind of show you the objectives real quick. And the objectives are primarily what you should be learning in this chapter. So you guys who are YouTube, you're already on receiving payments and insurance problem solving. And don't forget, you can get your book from elsevier.com. I do recommend that you get your books from elsevier.com. They have the latest books, and you still get a 25% off once you mention Sapphire Physician Code and pick that as your class. Okay, this is for all the YouTube students and my students too. Okay, so this primarily, we're just kind of going over what you're going to be getting into. So, we can't read everything because of copyright, but objectives. What are the objectives, Ms. Lambert? What you're going to be learning in this process. Define the revenue cycle management process. Access reimbursement payment, time frames for all submitted claims. I'm just skipping down, discuss secondary insurance and guidelines to billing secondary insurance. So you guys can pause this when you guys get ready to archive this video, okay? Explain reasons for claim inquiries and identify strategies to discover why payments are delayed. That's awesome. Review Medicare 5 levels and the redetermination appeals process and determine which forms to use for each level. So those are the key terms. And again, the key terms are to help you with your exam. Um, when you get ready to take your CPC, a lot of that is going to be on there. And remember, the CPC is an exam that wants to make sure that you know how to navigate through your ICD-10, CPT, and HCPCS book. Okay, so this medical billing class that we're doing right now is a fast class. I mean, we're literally done in a 2 week period on medical insurance and billing. Why, Miss Lambert? Because if you put away those 2 hours and you knock out those chapters, you are done. That book is probably about this big. It's not really that much. But when you do that book, you do your workbook with it. But you guys remember, I'm going to put up a regular schedule for you guys. I know the glasses are driving me nuts. Um, this schedule, you can't see this, but I'm going to flip over and see if you can see this schedule that I have. This what I'm pulling up right now is my Sapphire students regular schedule. You probably can't see it, but I'm gonna see if we can screenshot that for you so I can see it. And it's really not for you. You don't have to basically go by this. I just want you to have something else that you can kind of look at in regards to um, you keeping up with a schedule. Because remember, you're in a self-paced course, right? And in your self-paced course, hold on, it should be in recess. I just was looking at it. Download YouTube student schedule. Hold on, not that one. All right, so I don't want to spend too much time looking for this. I just kind of threw this in, but I'm surprised the schedule should have came up because it's already up. I don't get it. Okay, so let's do this. I should be able to share my screen with it. I'm gonna find it right now. Hold on, y'all. So why isn't it? Oh, okay. Well, let's try it. Let's try it. Let's try it. And this is just for us to kind of see. It's asking me to stop the share, so I don't want to stop the share. I don't know if you can see it or not, but I don't want to put it up there and you cannot see it. But for the schedules that you already have up there, that's what we're basically going to do. When we come back tomorrow, so remember, we have an extra class for tomorrow. I will put that extra schedule up there for you. And it's just to help you through. It's just to help you through. So some of us are home from 9 o'clock to 5 o'clock. If you knock those chapters out, you're pretty much done. Basically, I've given you 21 days to finish that. So it's really this week and next week will be your third days. So I'm gonna just drop up the key terms up there. So these key terms are the key terms for this chapter, okay? And again, I would like you to put them on index cards to help you learn points of medical insurance billing, names that you're going to use, such as adjudication. Adjudication is when the insurance company gets this claim and they are looking at this claim to see how much it should be paid, what should be written off, what should be adjusted. Okay, so that's what we call adjudication. They are adjudicating the claim. They're reviewing the claim. Okay. So administrative law judge, agent, when administrative law judge is kind of like when the doctor has to go before the judge if he's writing not too many write-offs, but he's doing so many surgeries and he doesn't have the backup for it, or maybe he does and he just hasn't put it in his claims report, or maybe CMS has done like an audit on them or something like that. Okay, aging report, that's your claims report. Allowed amount, appeal, claims denial. I love this chapter. Delinquent claim, denied claims. So you guys know I can't read all of them, but this chapter is amazing. Listen, this is your go-to. Remember, if you do not have your book, I want you to use your Kindle. Kindle books, well, Kindle books are not free, but you can get every single book from Kindle, and Kindle will let you look at least 100 or so pages. Okay? Look at least 100 or so pages. Okay, so let's go add to the stage. So we have this up here because I want to make sure that you get your index cards, you write these things down, and you remember some of them well, I don't know which ones you're going to remember, but try to retain as many as you can for your exam, okay? So, and you guys know the key abbreviations are in here as well. Don't forget HIPAA, HIPAA. Okay, so you guys know I want everything on index cards so that you can create your own 100, 200 box of index cards so you can study by. Okay, so look at this. So I left this here, certified medical billing specialist. Let me go back. Somebody asked me about this in regards to doing medical billing or something like that. So a certified medical billing specialist you can do with AAPC. And again, this is your go-to. This is your master book for your go-to. Will they ask me coding questions, Ms. Lambert? They could. They could ask you coding questions. That's why coding is included with this course. For some of you who do not want to go further with the coding, then I would go further with the medical insurance billing and continue on with the coding. When we get to our pre-wet courses, you will be using the CPC guide. The first chapter in the CPC guide is a must for you to use. Okay, so we will be utilizing that. And remember, after this chapter, we will be going on to medical terminology. So we're kind of breezing through medical billing. You guys got one more week of medical billing, and then you will actually be done with medical billing. Okay, so let's kind of move on. So just kind of take heed to that. Um, Revenue cycle management. Revenue cycle management is a process that healthcare organizations use to track healthcare services provided and patient care episodes from registration and appointment scheduling to the final payment of the associated fees. So you guys know, I'm not supposed to read the whole thing, but that's what it's all about. I mean, it's pretty much a cycle. I mean, billing is a cycle. It starts from the front and it ends at the back. Um, the first thing that you are going to do when you get in your billing is learn your area, learn your providers, learn your supervisors. Start working with your team, there'll be somebody to almost kind of hold your hand a tiny little bit. When you're in fresh new, right out of school, let's say when you're a freshman, it was just, you give somebody to kind of hold your hand a little bit. The most thing that you're going to have to do is to learn the EHR. You have to learn the EHR. You can retain what you're learning here. That's the billing basics. But you're going to have to retain what you know when you get ready to work at the hospital or the facility. Okay. So response from submitted claims. Let's read this one right here. An insurance company can accept responsibility to pay the claim and reimburse the healthcare organization. It can suspend the claim to investigate the details of the claim further, or it can deny the claim for a variety of reasons. A delay in reimbursement or payments to the healthcare organization can also occur when health insurance companies state that they did not receive the claim at all. Let's talk about that. When they say that they haven't received a claim, and I'm gonna put this up here, they haven't received a claim at all. They say they didn't get the claim. So what are we going to do? We are going to appeal that. We are going to send them electronic submission, which has the time, the date when we sent the claim, and we're going to see at the bottom of it where they had already accepted it. It's kind of like sending a MoneyGram or Western Union. We send it to you. We got the confirmation that you got it. How could you say that you're not paying it? We got it to you. They probably just didn't process it. So that's a grounds for appeal when they say they didn't get it. And that's kind of a part of adjudication. That's a part of adjudication when they are doing that. And it's just sometimes it's just a stall. It's just as a supervisor, manager, director, we know the tactics of the insurance company. They usually just try not to pay. So every little nick and cranny, they want to make sure it's done. I mean, if I was paying, I probably would too. Okay, claims policy guidelines. So you guys are going to read this as well. So don't forget, you're going to read this with your workbook and your reading book. Okay, so while you're doing your reading book, you're doing your workbook as well. Do them together. This is for the YouTube students. Sapphire students, when you get ready to archive this, you're doing the same thing. You just have tasks. You have tasks, and you also have competencies to do. Okay, Tamaya, I'm going to call you tonight. So just be precarious of that, and stay in order. I want you guys to stay in some type of coordination. There's a lot of you on YouTube, and stay in coordination. If you need to send me a message, send me a message. I don't know if it's down below or on the side. However you do it, just send me a message. You need help with it. Okay. If you missed a chat, okay, if you missed a chat, I'm coming on. If you miss a chat, all you have to do is send Miss Lambert an email, sapphirephysiciancoding@gmail.com. You all remember I took off the business email to make a specific email for my YouTube students. So if you have any questions, we've got that medical billing hotline. We've got the coding hotline. It's not really a hotline. I'm just saying it's a hotline. But if you have any questions, make sure you come in. Okay, so we can answer you, especially if you're getting ready to take your CPC. You do not have to be in the Sapphire class if you are getting ready to take your CPC to ask us a question. Okay, explanation of benefits. I've got to go over this. Okay, so explanation of benefits. And explanation of benefits is an EOB. YouTube, EOB, explanation of benefits. This is what you see floating around the office. You see a bunch of them over there. You see a bunch of them over there. Now that used to be back in the day. We used to have EOBs all over the place. Now EOBs is electronic. You see them online. You rarely get one in the mail, unless it's a denial. You go online and everything is done online. And it's unfortunate because a lot of people lost their jobs because of all this online stuff. So, okay, I'll get carried away. Explanation of benefits is a document the insurance carrier uses to both the health care provider filing the claim and the patient. The document details the outcome of the claims process for services provided by the healthcare organization. Now, this is very crucial because depending on which department you're going to work in, you remember the other day we were talking about workers' comp. We were talking about Medicare and commercial insurance. You will get to know what those ELBs look like. Medicare, that Medicare has a remittance advice. How come they didn't talk about the remittance advice? Or maybe we just didn't get up there yet. The remittance advice is the ones that we get electronically. They are talking about explanation of benefits because it's really the same thing. It's called the remittance advice because you get it on the computer. Okay, same thing with Medicare. Okay, so just be precarious about the explanation of benefits. That's where we get the money from. 9 times out of 10, if they send you paper, there's a check attached to that paper. So, if you're in the office and you're kind of new, just be precarious of that. If they hire you and you forget, go back to this check. That's all you got to do. Go back to this check. So when you finish with this medical billing course, you should be ready to work in a medical insurance billing office because why, Miss Lambert? You've already retained what's in here. Okay? You've already retained what's in here. This class is normally a 20-week class. Where am I? This class is a 20-week class. But I want you guys to think of it as a fast track because the fast track class for this was normally the 10 weeks, okay? Components of an explanation of benefits. I'm not going to go through the whole thing, but insurance company's name, provider of services. This is what's on the EOB. Date of service or procedure. That's your CPT code, your diagnosis, the amount that was billed. Why isn't they showing us a picture? Oh, here we go. This should be a better one than this, but I'm gonna come in now. So that's an explanation of benefits, and they're pretty much breaking down what they paid, what we billed, what was not covered, what was written off, what is not a bad write-off. A bad write-off. They do that in collections, and we're gonna talk about down the line. We're gonna talk about that. This is an explanation of benefits. Okay. Now, when you go to your office, those of you who will, maybe this is just a brush up for you and you're at work already and you just need to see a couple of these things. When you get to work, you'll have a specific group that you're working on and you'll get used to it. Just remember, when you finish the medical billing in this 3 weeks, just backtrack. During these 3 weeks, I'm going to remove that. So during these 3 weeks, you guys are going to create. I don't have one in front of me, but this is what my girls do. They create cards with definitions on them. These definitions help them when they are taking their test, because this is what they use to retain the information that we talk about. So when I start talking about the keywords, We go into the keywords. That's why I'm giving you those keywords. I want you to make your index cards so you can have that study. So, my YouTube students, your medical billing course is quick. Okay, your medical billing course is over next week. Those of you who missed some of those chats, the chats for this course right here is Sapphire ED CLS. The other courses that I have, those are introductions, those are notifications, that's informational purposes. It says Sapphire ED 2345 506. So y'all know I repeat that in every video. But this one I'm going to tell you is very crucial. I want y'all to make a study guide out of your index cards. Okay? I know I got my glass. I can't find my other glasses, and these are just driving me nuts. Make your index cards so you can use them as a study. This week we have 4 classes. We have 4 classes this week because I had to put the Tuesday in there for this again for the 5 and 6. When you get off from work, I know you have to do the 5 and the 6, and you have to do the kids. That's fine. So again, if you guys want me to move to 7:30, I can move to 7:30. It's not a problem. We do 7:30 to 8:30. I just kind of like it to still be light outside. I know one day I'm gonna get this room back to how I had it, but I'm in the process. But I want you guys to have something to study by. Okay, so this is for my YouTube students. Make sure you do not miss a chat. Okay, if you've missed one of these chats, those of you who might have just joined, this is the medical insurance billing chat. Okay, this is our 5th chat for medical insurance billing. This is our 5th chat. So we've got a chat tomorrow. We've got a chat Friday and Saturday. Week 15 is over. Week 15 is over. Okay. So I'm gonna drop this up here. Week 15. So this is this week. Okay. So we're doing 5 and 6 today, 5 and 6 tomorrow. All right. So let me just go back. Let's put this back. So remember, that's that EOB over there. We're just gonna kind of go past it. Okay. Let me take that down. So I don't know how long I can leave them up there. I mean, they're pretty much just screenshots. It's not like we can move them. But this is a good one. This is in your book. I'm on page 388. So when you get your book, I mean, you can just kind of go straight to this if you want to. But you guys should be on the same page that I'm on. Okay, but again, this is a sample from Aetna, just kind of giving you patient name. Remember, we said patient name, accounts number, primary insurance is Aetna, secondary is Blue Cross. You see this right here? This is the aging. These are the aging days. So I'm looking for money before 31 to 60. Me as your supervisor, I'm looking for my girls to get this money now. Once this money starts trickling, it gets under a cover. Y'all gonna have to start digging to find this money. So 0 to 30 is probably the claim drop to process to 30 days. 31 days, where's the claim? I want y'all to start calling. Where's the claim? Don't wait till 60 days, okay? Find the claim or you'll be sitting up here, I don't know why that's there, over 120 days. Next thing you know, we have to write it off. We have to adjust that off. So us as a supervisor, those are the things that I dread to do, writing something off. I mean, I've had people that I know that are, people I know that work in the billing, and they've just written stuff off just to start fresh and get rid of it. It's an easy fix, but it's still money lost. But then when you go, well, okay, how much money are we going to pay somebody to do this rather than us just write it all off? If she's going to take 3 or 4 years to get these thousands of dollars, and then you still have to pay her $25 an hour for 3 years, how much money do you think we can get? Put it outside, let an independent contractor get it. If she gets 10 to 12 cents on a dollar, give her 30%, and we take the 70. So that would be the proper way to do it. And that's where you would come in if you had your own business. You got your own business, you're going to do somebody's billing on a 30/70. That ain't bad. Some of them doing a 30/70, or they do 10% or 20%, depending on the person that you're working for. So, that's what we do, with collections. Some providers, want you to get that money, and some are going, all right, just write it off. Who cares? Let's start fresh. Get us a new billing team and start fresh. Okay, that ain't me though. I'm ready to find somebody to go find that money, especially if it's on the 10% or 20% and an 80. There's plenty of billers out there that will go for that money. Okay, claim inquiries. You guys know about claim inquiries. We're reviewing an agent report unpaid claims that are more than 30 to 45 days old, or it's time for you to call. Okay, that's inquiries. Okay, this looks like a statement. Hold on. Wow, why is it not going back? Okay. Okay, so I want y'all to pay attention to this. Look at this right here, because this can give you a good example of what you're going to be looking at when you're in the office. Wood Hills, dear sir, here with a request for a committee review of the above named case. Since I consider the allowance paid very low, having in mind location, the extent, XYZ, XYZ. They're just pretty much trying to ask for more money. Maybe they got a little bit of money, but that's what it is, like a sample of this. Okay? Inquire about the claim if any situations occur. Okay? What time is it? I'm trying to stay within an hour, guys. Okay, lost claims, problem lost claims, solutions, rejected claims. Let's do rejected claim. A rejected claim is a submitted claim that does not follow specific third-party peer instructions. Okay? I thought I had this up. I'm sorry, y'all. So, okay, so I can't move it or anything like that, but this is it right here. Third rejected claim. I'm gonna go back a little bit. I was looking at something. This is what I was talking about a few minutes ago. This is like a tracer claim. They want to get more money. They feel like they did more to only pay $75. They think that the claim should be more. Okay, so we're just going to slide down to rejected claim, problem, solution, problem, solution, problem, solution. They trying to tell you what you should do. So problem, the claim was submitted a claim is submitted for several services. One line item is rejected for incomplete information, but the other services are paid. Solution, generate a new claim for the rejected service online at note in block 19 of the CMS 1500, which we looked at the other day, form that it is a resubmission. So sometimes a claim can get rejected as a duplicate, okay, when it is probably a resubmission or something that they corrected, which we might consider as a corrected claim. So that happens a lot. Oh no, we got the claim Monday. You sent it back again on Tuesday. We sent a corrected claim. In your claim form, there's a little spot in your claim form that I sent you the other day. You have to put the CC in there, and that code lets them know that it is a corrected claim. Okay, it lets them know that you did a corrected claim. So in this case, they're saying that they resubmitted the claim. We're letting you know that we submitted the claim in that box. Okay, so add it back to the stage. So again, when you do your study, it's all about paying attention, and this is good too. Make sure you guys get this: common reasons why claims are rejected. It's all about studying. It's all about studying. Problem solve, problem solve. Same thing. That's kind of like the same thing that we just did. Down coding. This is a good one. And this will relate back to the chapters that we just did, especially chapter 3. Remember we did the chapter 3 with the ICD-10, CPT, and the HCPCS. So let's just at least say with down coding. Let me make sure I got it on here so you guys can see it real quick. I don't know. This is for fairground, so hopefully they don't boot it out. But this is live, so I hope you guys don't miss it. If they take it off, we're gonna miss out. Okay. Problem: the insurance carrier has downloaded the claim. Okay. In these cases, the adjudicator or computer software determines that a lower level of procedure or service may have been warranted than was billed by the provider. Therefore, there is a reduction in reimbursement. Okay. That's the worst thing that we can get. That means somebody didn't code this correctly. Okay, somebody didn't close this correctly and they reduced our payment. Okay, now they're going to tell you what you should do. Okay, solution: be sure to read through all procedure notes. You hear that? Be sure to read through all procedure notes. Take a pencil, take a highlighter. If you don't understand search engine, or call the provider. Okay, be sure to read through all procedure notes and providers. Provider orders to determine the most specific diagnosis code related to the patient's condition. If the patient experiences complications, these should be added to the code. If the service provider's if the service provider's notes are not specific enough to determine a more specific diagnosis, emphasize to the provider the importance of specification. You know that word, specificity. We hate that word, especially regarding diagnosis. I'm not going to try to say it. How we say specificity? I forget it. Crucial. This is why I tell y'all: do not be afraid of the provider. Don't be, what is that? Do not be afraid of the provider. Okay, I don't know what that is. If you have a question and you query the provider, he will help you. If he just looks mean, just don't look at him. Just ask him a question. Send him an email. Okay? The email is crypt, so you should have an email with your EHR. Your Epic system should be encrypted, so not from your own email. Y'all know what I mean? So this is where the nurses also come in. You have registered nurses who are utilization review nurses. I met one a couple of days ago. I need to call her. And you could call them. You could say, listen, I had this code was that. Can you ask Dr. Jones what he really meant, or XYZ? So that she is going to be your go-to. That RN is your go-to. If he has no right hand, then you're going to have to go straight to him. Okay, you're going to have to go straight to him. If you just afraid, then let your supervisor handle him. Okay, just tell her what the problem is, all right? Just tell her. But coders, don't be scared to query the doctor, all right? And that's one of the things. Sometimes the coders are afraid of the providers. And when that claim shoots through like that, that's the worst thing, because all you have to do is just ask him. If you're scared of him, just email him. Just make sure you email him on the hospital software. You have encrypt software at home. This I'm talking to the coders. Coders, y'all working at home. Y'all got encrypt software on your computer. Let him know. I told you, when you have a provider, right? You might have 4 providers. You working at home, you got 4 providers. Those providers are expecting you to be their right hand, because you are the one who are doing the codes and submitting those claims. Okay, well, you're not submitting the claims. Once you finish with it, they go on another queue. Okay, they go on another. The charge entry person, they go on another queue. If those claims don't drop straight through, they're coming back. When I say they go straight through, this is how it go in the front. So I know I'm remembering how we get down at Trinity. All right, so. Doctor does the surgery. Doctor does a procedure in the office. Doctor does the intake sheet. Doctor puts the codes on the intake sheet. The nurse in the front, or the medical assistant, is the one who follows up with him to make sure that he signs off on all that paperwork. And you, as a charge entry person, gets that from her. She's supposed to come and bring it to you. Ain't no you going around and to get it to her. She's supposed to bring it to you. You're supposed to have those charges in that system by the end of the day. By the time you put those charges in that system, by the end of the day, it goes to another queue. Then it goes to the coder who works in Belvedere, Texas somewhere. Okay? If she has a problem with that record and she cannot understand it, here we go. That's another day we got to waste for that claim to go, because now she got to get to you and say, what did Dr. Jones put? I don't understand what he's saying. So she's got to backtrack and get back to that medical assistant or that RN and get that note back to him, and he better go ahead and fill it out right. That's why we have to make sure we are precise, and we have to make sure that we are our surgeon's friend, because we need the surgeons to write clearly. And some of them don't care. But everybody knows doctors have the worst handwriting. But what are you going to do? You have to be your provider's right hand. Okay, guys? Okay. Underpayments, overpayments. I know I wasted time. I should have been through with this. Wait, I don't have to share my screen. I'm gonna share my screen with you so you can see what I'm scrolling to. I mean, we're not reading anything. We're just kind of going through, just kind of see what's what. CMS review appeal process. An appeal is a request for review and reconsideration of a claim that has been underpaid, incorrectly paid, or denied by an insurance company. Some insurance carriers may refer to appeals as redeterminations before starting an appeal process. I mean, again, it's a process. If you see something and they underpaid it, you're gonna have to do the appeal for it. Okay, 9 times out of 10 you win. Okay, you win 9 times out of 10. You win. Well, okay, I won't say, but my team, we did. I mean, there's a lot of digging that you're going to do if they come back and say, "Oh no, no, this is X, Y, Z." Um, just be precarious. And yes, sometimes in offices they already have letters pre-made. All you really have to do is fill it out. Okay. And look at this. She just requesting a committee review. The committee review is pretty much she just consists of the utilization review nurse. That's the UR. That might be on your CPC. So take heed to that. Let me put it down. You want to take a look at that? So again, the UR utilization review nurse, she's the one who's going to see this, okay? She's the one who's going to see this, okay? And they make decisions. Yeah, they make decisions because they know all about the case. They know what's going on. So that's why we do that, okay? Okay, let me see what we have. Redetermination, national provider ID. You guys already know. Reconsideration. Let me take this down. We got this up too much. So there's a lot of stuff that you're going to learn in chapter 5. Okay. And we've only done the first part, and I haven't even gotten to the other section yet, which I'm going to go ahead and get to it right now. You guys are going to go ahead and look at the rest of that. Let me just come down. Get rid of that. Okay. I don't know why I'm on 7, 4, 5. All right, so let's just look at collection strategies real quick. Let's see. I'm gonna put it up so you guys can see a little bit of it. These are collection strategies in case you're working in a collection department. Explain the cash flow cycle in healthcare organizations. Describe guidelines for missed appointments. Discuss fees with patients. Describe patient options available. Explain statutes and limitations of 3 kinds of financial accounts. State and discuss the role of a collection agency. Identify and describe special collection issues. So again, this chapter is going to help you in your daily work that you are doing on your job. Okay, so I'm going to just jump into a couple of key terms real quick. Accounts receivable, age analyst, automatic stay, balance, bankruptcy, bonding. This is a very important section because in medical billing, there's so many different positions that you may do. You need to know this. Remember what I said. Put these words on index cards. Creditor, credit card, cycle billing, debit, debtor, discount, done messages, e-check, embezzlement, estate, administrator, financial accounting record, no charge, skip tracing, unsecured debt, and write-off. Okay, these are the abbreviations that I want you to go through. So this is just a quickie because collections is pretty much easy, a lot easier than the first one that you're going to do. So take heed to the section that we did above this. Okay, so we can look at this right here. She's just pretty much telling you about what she did, and like a lot of these books that you guys see, a lot of coders and CPC persons, they contribute what they know to this book. So that's why you see these people in here like this. They contribute this, and here you see collection strategies right there. That's basically what it is. Credit cards, debts. It's going to show you how to handle that medical office flow chart and billing procedures. This is just like an SOP. They're telling you how they want you to do the claims. Okay. You remember what I said? When you get there, they're going to show you what to do anyway. They're going to show you what to do anyway. You want to know how to do medical billing? Do this book. You finish with this book, you pass the competencies, you could do medical insurance billing. Collection trio. Okay. So I'm patient registration form. Let's do this one. Fee schedule. As discussed in previous chapters, a fee schedule is a listing of accepted charges or established allowance for medical procedures. So all offices should have a fee schedule. Medicare usually shoots off their fee schedule. A doctor's office or wherever, you should have a fee schedule. A fee schedule is what they charge for what they do. Okay? So just to be precarious of that, and they're going to show you that in the doctor's office anyway. There's no surprise billing. They want to show you that it is expected unbilled balance. They're going to show you that. So that's why I tell you guys. Let me jump out real quick. Don't be shy about going in and doing the medical insurance billing, because you don't have to have 2 and 3 years of medical insurance billing. You don't really need a degree for medical insurance billing. I mean, you have some people that are, you have a degree for, why? They're going to give you the same book for medical insurance billing. Practice, practice, practice. If you can pass their entrance exam, if you can put enough on your resume that you know about medical insurance billing, you don't need a degree. They don't go in and say, "Oh, do you have your degree for medical insurance billing?" What? How did you get your information for medical insurance billing? Sapphire physician coding. That's what you're gonna tell them. Sapphire physician coding. You went to a course for Sapphire for medical billing and coding. That's what you tell them. That's what you put on there, because you're doing a course for medical insurance billing. That's what you can put on there. When she give you a test, hopefully by the grace of God, you pass. So whatever you get out of this Sapphire physician billing courses that I'm giving you, make sure that you are able to pass an entrance exam. I'm pretty sure a doctor will let you in there. Okay, but you guys in the YouTube, I suggest you go through the full course, especially those of you who've never done medical insurance billing before, and those of you who've never done coding before. Okay, I got your back. I got your back. Okay. Okay, so let's move on. Okay, so I'm not going to go through this whole thing. Just make sure that you guys do this chapter, because this is a part of your work for today. Tomorrow we're going to go over your workbook. We're going to go over the workbook. Let's dive into revenue cycle management. Let's put it up real quick. Revenue cycle management. Okay. I'm going to take it down. I'm just going to read a couple of things because we really can't read too much of it. Receiving payments and insurance problem. Define the revenue cycle management process. Yes, that might be on your CPC. Okay, might be on your CPC. So just be precarious of it. Okay. Discuss secondary insurance guidelines. Explain reasons for claim inquiries. Review Medicare. Yes. Oh, here. Reimbursement, rebuild. Make sure you get your key terms, okay? Adjudication again. Make sure you get your key terms, guys. Put them on your index card. There's your abbreviations. I love it because when you go over this, it helps you to stay in check with some of the stuff that they're reviewing. You remember revenue cycle management, RCM? We went over that in the other chapter. It's the same thing. It's kind of repetitious, but it kind of keeps you abreast on some of the stuff that you're learning. It helps you. It helps you to remember. It helps you to remember. Okay. So claims policies, insured. That's the kind of stuff that you guys are going to go over. Okay. So let me just go down. I'm going to clear this up. Let's see what's down here. All right. So, introduction to healthcare facilities. I'm going to put you there. Introduction to healthcare facilities. So, we're touching bases on 6 now. I hope you guys got something out of those first 2 chapters. Just kind of take heed to, how you're studying, so you can keep up with your work, okay? So, again, introduction to healthcare facilities and ambulatory surgical centers. Describe the various types of healthcare facilities. Describe the components of inpatient prospective payment system. That's going to be on a test. They're going to ask you what that is, okay? Describe the component. No, I don't remember right off the top of my head, but it's definitely going to be on your test, okay? Describe other types of prospective payments. And you guys, just right here, describe the components of the inpatient prospective payment system. Could you guys, like a Medicaid thing, Medicare system, can you guys give me a summary for this? I know you're not in my class, but I want a summary for that. Okay, understand, well, you are in my class. Y'all in the YouTube class. Wait a minute. Okay. Oh, I'm sorry. I thought y'all was looking at it. Okay, so there you go. Real quick. So I don't know how much we can put. Real quick. I'm just going to remove it. But you guys should have your book by now. We've already done, this is our 5th class. So you guys should have your book by now. Okay. This is going to be on the test. Can you guys see that? That 72-hour rule? Chess, and chess. Okay. That's going to be on the test. I'm pretty sure. Okay. So this is the hospital keywords. Make sure you guys get your keywords. I'll pop the keywords up real quick. Make sure you guys get your keywords down. All right. I know my time is, I only got 10 minutes. I'm so sorry. Okay. Um, Skilled nursing home, hospice, home health care. I'm just giving you some of the facilities, clinics. Okay. Those are some of the places that you can bill for. Okay. That you can work for doing medical billing. The Joint Commission TJC provides accreditation to hospital laboratories. That's a girl I met the other day. She worked for accreditation for hospitals. CAs, HAs, ambulatory care facilities, and pharmacies. Its accreditation standards establish expectations for a safe and effective patient care. That's pretty much the bottom line of it. I'm on page 446, so I want you guys to look at that in your book. My page is 446. You may have a different page, okay? Um, oh, this is good right here. This may be on there. Sometimes they want to identify a couple of eponyms for, maybe providers or a certain type of medicine. The American Osteopathic Association, AOA, provides board certification for doctors of osteopathic medicine, DO. That provider's credentials is DO. They may have it on the chest, okay? What is NP? What is, DO? What is doctor? What is, you know what I'm saying? So just be precarious of that, okay? Healthcare Facilities Accreditation Program. They may say, what's HFAP? So again, you want to just kind of be precarious of that. I'm going to show you real quick. Be precarious of that, okay? All right. Medicare certification ambulatory surgical centers. This is where you're going to learn that at. And let me get you back. Make sure you pay attention to this because a couple of my girls had a couple of issues with this. Some of that's on your test. On your CPC, they ask you a lot of these are going to be called open and closed questions on your CPC. Open and closed questions. So these questions they will be asking you. Okay, they will be asking you, and they're going to be multiple choice. What is ASC? Okay, Medicare Certification Ambulatory Surgical Centers. Make sure y'all pay attention to that. Okay. These are just a couple of CPT codes here, and when you get your book, you can go over this. There are just a couple of CPT codes that they're giving you as far as surgical procedures, inpatient, outpatient, and non-patient services. This, I'm telling you, y'all, this is your go-to guide. This is your go-to guide to learn how to do medical insurance better. There is no other book like this one. I don't care what brand you get or whatever. Linda Smith has done her thing right here. Okay? So I want you guys to make sure you get her book. You don't have to get the year. You can get any year. Well, not any year. Try to get 12 and up. Okay. Charge Master. Remember I was talking about like charge entry, stuff like that? I want y'all to read just so y'all can know what Charge Master is. But a lot of the revenue cycle has, different types of apps, different types of service charges. And this is pretty much going to give you a database listing of what you do. Like Epic, I don't know. If some of you have used Epic before, any type of EHR, you know what I'm talking about as far as the Charge Master, okay? That's where the money is at, okay? It's going to show you a whole long thing, and it's like a accounting database, okay? When the charge entry person puts all her charges in, the money populates automatically. Post discharge. Discharge. Can you see it? Discharge not final billed. That's on your test. I'm pretty sure they're going to ask you what does that mean. Make sure you go over that. Okay. Reimbursement methods. Do I have you up? I don't want to have it up too much. So I'll just try to put up a little bit so y'all can see. This is what you got, diagnosis related group. That's going to be on your test. They're going to say, what is that? What is inpatient prospective system? if you have to read this book 3 times, just go ahead and read it. Just know that you need to get it down for your CPC. Some of you guys who are not going for your CPC, it's okay. Um, listen, the CPC is for expertise coding. You're a master at the coding when you become that. So this book is going to help you with your open and closed questions. I can't believe it. I have 5 minutes left. Okay, so make sure you go over this book, guys. Okay. These are some diagnoses in here, and you also can go over that. Now, I don't know how long the Kindle books will take you. I mean, when we did this last year. They gave us like 100 and something pages in there when we did it last year. So you can use it. Okay. MSDRG base rate. Ooh, this is a good one. Let me put this. I have to put this up. Look, that's going to be in the first section of your CPC block and your CPC guide. I teach this when you get to the CPC guide. Okay, the CPC guide is your core courses, but this is what's in there. So this book, Medical Insurance Billing Book, is giving you an idea of what you're going to be doing. I'm gonna show the book. Matter of fact, I'm gonna show the book right now. Let me show the book right now because I didn't show y'all the book. Let me show the book. There you go. Uh-oh. Why didn't it pop up? Okay, hold on, y'all. Hold on, y'all. Okay, here. I didn't get a chance to show y'all the books, but I'm just showing you because these are books you need to take your test with, and the ISBN numbers are here. So I'm just going to show you this real quick. Okay, you got to have this book right here for this class. This is the book that you guys are going to use for this class. Okay, the workbook and your other book. Okay. I say your other book, your reading book and your workbook. So make sure you read it thoroughly. This is a medical insurance billing class, and we teach from what you see right here. Okay. When this class is over, you will be using this book. Okay. When this class is over, you will be using these books. So that's your next course after medical terminology. Okay, I know I'm not used to braids, but it's so hot down here. I can't do nothing with my hair. Okay, so just take heed to that. I'll just do the books up there for a hot second. Just do the books up there for a hot second. Let's get rid of the books. Okay, so okay, status indicators. Status indicators. You guys will probably see this. The status. Let me see if they can see this. Your status indicators. You'll probably see this on your claim form. There you go. Status indicators. Okay, I gotta take it off. But they're gonna ban us from showing books. But again, it's for it's educational purposes. I have to show y'all this. I found the UB92. You remember we were looking for that yesterday? Ta-da! We were looking for that yesterday. It was not in there. This is a claim for hospital. Okay. Let me see if they're using UB92 or the other UB04. They're using the UB04. You see this, guys? Same thing. UB92, UB04. The UB04 came out after the UB92. Okay. And remember the HICFUS claim 1500. So here we go. I finally found one. Even though there's one in your classroom. Okay. Sapphire, you have one in your classroom. I know I got 2 minutes left. Okay. So you're going to go over, I'm going to take this off. You're going to go over this chapter. And 6 only has one chapter. One, Introduction to Healthcare. This one has that chapter, and then we're gonna go over this one because it actually has 2. It has 19 and 20. So this is the other one, 20, billing for healthcare facilities. So this is what you guys are doing starting this week. Okay, this should be done. I don't know where the other schedule is. So you got Monday, Tuesday. This should be done by Friday. These should be done by Friday. So today is 5 and 6. Tomorrow is 5 and 6. Friday, you should be done with 5 and 6. Friday, we starting on 7 and 8. Okay, we starting on 7 and 8. I think I'm gonna extend 7 and 8 to Saturday. Okay, and Saturday I think we're gonna do two classes. I might be on the road Saturday. I gotta figure that out. But I'm gonna try to. You know what I'm gonna do? I'm gonna have to re-record a class for y'all for Saturday. Okay, because I'm not gonna be able to do a live. Um, I don't think I'm gonna be able to do a live. Well, yes, I can. I'm traveling. I'm traveling Wednesday, Thursday, Friday morning. Yeah, I'm all right. I'm all right. I'm all right. Okay, so I just want to kind of look at this real quick. Your objectives: explain the differences between professional and outpatient, inpatient services. Discuss guidelines for coding and principal diagnosis. Explain how to code from the ICD-10 10 PCS. I'm gonna show y'all this. Just a brief course for this. Okay, and again, get your key terms down. Get your key terms down. I'm gonna show you key terms real quick. Uh, Make sure you put them on an index cards. So those chapters, we're already out of time, but those chapters are what you're going to do. Okay, and good luck. Take your time. You will get it done. Don't forget, these chapters should be done by Friday. This class is not going to be done until the end of the week, but 5 and 6, I want 5 and 6 done. You too by Friday. Friday, you guys are starting your 7 and 8. You're starting 7 and 8. So if you have any questions, let me know. Your workbook and your reading book. Okay. Make sure you get those down. Okay. So I'm gonna sign off. I'll see you guys next time. I'll have my glasses then, right?